Hello, everyone. Welcome to another edition of the Diabetes Reversal webinar brought to you by Meditrina Clinic. My name is Lois Samari, and I'm excited for everything we have lined up for you today. So, please give a couple more minutes for other people to join in. I would love you to share this wherever you're watching us from, YouTube or X, which is also Twitter. Share this link to as many people as you know. We're having a doctor come up today. We're having a registered dietitian coming to tell you all you need to know about reversing diabetes. All right, so like I mentioned, we'll give a couple of minutes and then we can start. Thank you all so much for joining the Diabetes Reversal webinar. As I mentioned earlier, we'll be starting really soon. What I want you to do is I want you to share this with everyone. Make sure that you're sharing the link to everyone that you know so that we can start. We're having Dr. Amaka. She's here tonight to tell us everything that we need to know about, to tell us everything we need to know about reversing diabetes. You can ask your questions, and there is also the opportunity for you to win if and to the simple questions coming up. Right. So tell everyone that you're trying to tell a friend. Welcome. So we would start in a minute. Tell them. So you can share our YouTube link or you can find us on X. I'm dropping the link in and share it to everyone that you know so that they can join in and they can get the best of all that we have for them. All right. Thank you all so much once again for joining the Diabetes Reversal webinar brought to you by Meditrainer Clinic. And this evening, we're going to be telling you all you need to know about type 2 diabetes, what it is, the symptoms, and all of that, as well as what it means to reverse diabetes. I'm sure many of you joined in asking the question, is it even possible to reverse diabetes? And you have a lot of other questions surrounding what we'll be speaking about today. But don't worry, the experts are here to tell you everything that you need to know. We'll also give you an opportunity to ask one or two questions and also let you know how you can be involved in our program, in our diabetes reversal clinic. All right. And like I mentioned, stick to the end. We have something for you. There's an opportunity for someone joining this webinar today to win a 5,000 naira medication voucher, meaning that you can get 5,000 naira worth of medications for diabetes or hypertension if you do one simple thing at the end of this webinar. All right. So I want you to stick to the end and make sure that you participate. So this evening we have Dr. Amaka with us. Hello, Doc. Can you hear me?
Yes, I can hear you. Good evening, everyone. So, can everyone,
Good evening, Doc. It's so nice to have you.
how is your day going? So, can
It's
we?
going quite well. Rains are so, but we thank God it's all right.
Okay. So, guys, let's talk about diabetes. So, diabetes is common, is popular. Everyone knows diabetes as a sugar disease. Yes. So, by definition, diabetes is a chronic disease that is characterized by persistent increase of blood of sugar or glucose in the blood that can later lead to complications in the heart, brain, eyes, reproductive organ, and so on. So now, the key words here is now glucose or sugar, insulin, and the pancreas. Now, sugar or glucose is what the body needs to do its function, is the fuel that the body, the brain needs, the muscle needs, the other organs in the body utilize it for its function. Now, what about insulin? Insulin is a hormone that regulates blood glucose or sugar. Now, insulin is also produced by the pancreas, the beta cells of the pancreas. Now, when we understand these things now, it will help us, it will simplify this diabetes of a thing for people that don't have the idea. So, diabetes have the types. It have four types, but the most common two is the type 1 diabetes, also called previously called juvenile diabetes. Now, in terms of prevalence, like 10% of the population have type 1 diabetes. Now, the type 2 diabetes is more common. 90% of the population have type 2 diabetes. So what causes it? Now for type 1 diabetes, it can be viral, can be environmental factor. That's why people call it it's more of an autoimmune disease. Now, in type 1 diabetes, insulin is not produced. This insulin I said previously that helps to regulate blood glucose is not produced at all. Now, for the type 2 diabetes, now type 2 have there are so many things that can cause it. Now, let's start with the metabolic syndrome. Here we have high blood pressure. We have BMI, over obesity, overweight, obesity. Now we have decreased HDL. HDL is the high density lipoproteins. Now we have also the increased triglyceride. We have smoking causes it, and then the family factor, the gene. Now, these are some of the causes of type 2. Now, another thing that causes type 2 is iatrogenic. We have a patient that had a brain tumor, And then he had seizures and he was placed on steroids. With time, and he tipped over to type 2 diabetes. So now the causative factor for this type of diabetes is now iatrogenic because it was caused by the steroids he was placed on. Another type of diabetes we have is the gestational diabetes that is seen in pregnant women. Now, the good thing about this type of diabetes is that once after delivery, everything goes back to normal. But now, sometimes in the future, these women will now have the type 2 diabetes. Now we have the pre-diabetes. Here, the blood sugar is high, but it's not high enough to be called type 2 diabetes, and it usually doesn't have any symptoms at all. Now, gestational diabetes also doesn't present with any symptoms. It's something that is found during antenatal, or maybe for women with preeclampsia, during those tests, and the sugar is found in the urine. Now, what are the symptoms? The four major symptoms is excessive eating, polyphagia, unexplained weight loss. That is the reason some people discover they have diabetes. They suddenly started losing weight, but they know they have good appetite. They start losing. When they now go to the hospital, they now find out they have type 2 diabetes. Now, polyuria, excessive urine within like 5 liters of urine within 24 hours. So now let's talk about why are we talking about diabetes? What are the reasons? Now, it's a chronic illness. It's something that involves you taking medication almost every day. Some people take it once a day, some people take their drug twice a day. So it's chronic. So sometimes they are now depressed. They are tired of managing an illness for over 15 to 20 years. They spend money. These drugs are not cheap. They spend money to buy it to the hospital. Now, some form of this diabetes is life-threatening. The acute form of it, like the diabetic ketoacidosis and the HS state. Now, it can kill someone within 4 hours, 2 hours. Someone can be rushed into the hospital. Next thing, the person goes into coma. Next thing, the person is dead. So that's the reason why we need more information about diabetes. Now, the complications of diabetes, they are just too much. Sometimes amputation of the leg, stroke, myocardial infarction, blindness, poor libido, and the rest of it. Now, these are the reasons why we need to know why we need this information about diabetes mellitus. Now, another thing is early intervention. Now, Wella Health Mediterranean is gathering all of us here. One reason is early intervention. You need to work with someone, a registered dietitian, that will put your lifestyle in check. Because if you are out to reverse diabetes, the major thing is lifestyle change. Lifestyle change is the major thing. That is the only thing you need to do. That is not the only thing, but the major thing you need to do to be able to reverse diabetes. So that is why early intervention is key. And you cannot do early intervention. You cannot get this information without your healthcare provider, without a registered dietitian. So that is why we are here. So if you have a relation, like a parent that have a diabetes, the information you get here will be very helpful, because the knowledge is power. Now, from this, you know how to the causative factor, we've talked about it. Now, what about the diagnosis factor? Normally, almost every time, the fasting blood sugar is used, and here you get 126 milligram per day, above 126 milligram per day for fasting. And then another diagnostic test is the glycated hemoglobin, HbA1c. Here it is usually above 6.5% for the person to be termed diabetic. So the information is important. What causes this complication? This complication doesn't happen within 1 year, 2 years. It's something that happens over time, within 5 years, 10 years, and is mainly because of the atherosclerosis. Now, the arteries, these major arteries fatty plaques deposits on it. Now, when they have finished depositing on it, it will narrow the blood vessel. Now, let's say the adequate amount the blood vessel of the brain needs is 100%, or let's say 80. This narrowing we decrease it to 40. Now, the blood vessels of the brain, of the heart, will not be getting the adequate supply it needs. That is where the problem comes in. Now, for the heart, coronary disease steps in. The person can now start having peripheral vessel disease. The legs, there will be claudication. What about the brain? The person can have a stroke. What about the eyes? Blindness can set in. The blood vessels supplying the retina will start being disturbed, and the person will not see again. They will move from one stage of blurry vision, then to definite blindness. Now we have other organs where this complication can cause issue, especially the nerves. Excessive blood sugar, when there is excess blood sugar in the blood, is now going to cause the diminution of the swan cells. Now these nerves, the swan cells, is no longer going to have the myelin covering that makes it to work very, very well. Now there will be problem. Now they start having this paresthesia, and sometimes they will tell you, doctor, while I'm working, it's like I'm working on a foam or something. They are not feeling it again. They will be having sensory loss. When they touch themselves, they can't feel it again. Now, this is part of the problem that diabetes causes. Now, when this individual now have a wound on the leg, he may not notice it immediately. Now, by the time he would have noticed it, infection must have set in. And if it is not managed properly, that small tiny wound can lead to limb amputation. Sometimes some people have double limb amputation. Now, that is part of the problem that diabetes causes. Now, another thing, I've talked about the blindness, then cataract too. Cataract, diabetes causes it. Now, for the reproductive organ, the blood supply to it can be disturbed, and there will be erectile dysfunction. It won't be able to function normally again. So diabetes causes a cascade of things, of complications in the human body. Then the depression, the poor sleep. And now let's now talk about why we are here, about the lifestyle change. This atherosclerosis I mentioned previously, that is the bedrock of this complication. Fat deposits. Now, this fat deposit is mainly by the low density lipoprotein. When you start working with the dietitian, she's going to put you through on the type of fat that you need to cook your food, and also the quantity that you need to be able to move away from this complication and set your heart in a very good space. The dietitian is going to work with you to tell you that, okay, leave the saturated fat. Saturated fat is things you get from mineral, cake, biscuits, red meat, and cheese, and the rest of it. Now she's going to tell you, educate you about the good oil, the olive oil, the nuts, the quantity you eat too, because it's not about doctor, I'm eating this every day. What quantity are you taking? She will educate you on the right quantity that you need to eat to be able to be in this good lifestyle. This information will help us to increase our health span. Yes, even if, let's say, you don't have diabetes, but you need the information, it will help you to know your numbers. For people that have parents that have diabetes, know that, okay, when in the morning, I ate eba and my sugar didn't spike, but when I took a half bottle of Coke, it shoot up immediately. Then you will know that, okay, I need to start leaving Coke, and let me eat things that have complex carbohydrate, that have fiber, that will make me to stay filled. Once I'm filled, it's going to help me to move away from the complication, because the information about diabetes is to help us not to go deep into that complication, because when they start, they have started. Now, a knowledge about this reversing diabetes. will also help us to know that the dietitian will work with us. Let's say you take like 5 tablets a day for your diabetes. That's what you've been taking. Now, when you start working with the dietitian and also with your doctor, with time, when the control is very good, you may not have to be taking like 2 tablets or even 500 milligram of metformin. That may be what you need every day. Or sometimes you may even have to reduce it to 3 times a week. That is the beauty of this program. It's like a 12-week program. You work with a dietitian, and it's very, very important because diabetes is a global illness, and the weight of it is so much because a lot of people are going through that poor lifestyle. Yes, family history can cause diabetes, quite all right. Smoking can also, someone that is smoking can decide to stop smoking so as to be able to to chase out diabetes and its complication in the future. So now, in conclusion, diabetes have complications, yes, but that complication can be managed. Yes, the complication can be managed, it can be reduced drastically. This information is important so that you know your number. For someone that already you have diabetes or you have a parent that have diabetes, it will help you to be able to track your numbers, to know when it is increasing, when it is reducing, and when to call your doctor. And also, this knowledge is also important because of the life-threatening part of diabetes, the ketoacidosis and the hyperosmolar state of diabetes. So now we need to make use of this information. We need to register for this program, and they have to work with the registered dietitian and the Wella Health team as a whole. Thank you.
Hello, Doc. Hi, Doc. Can you hear me now?
Yes, I can hear you.
Okay, thank you so much, Doc. I think my network took me out for a second there, but I'm back now. Thank you so much. That was really informative for us. If you learned something from everything that Dr. Amaka said, I want you to put it in the chat section wherever you're joining us from. So if you're from YouTube, would love to see your comments or questions if you have any. And if you are from Twitter or X, we would also love to see the same. All right. Thank you so much, Dr. Amaka, once again. So we're going to be having very quickly registered dietitian Tito to come up. A lot of information about what it actually means to reverse diabetes and all the questions that I know you have been beaming and boiling with. She's going to be answering them all for us this evening. Now, as a quick reminder, right, we have 5,000 naira worth of medications in a voucher to give out. So there is a 5,000 naira medication voucher for someone that is on this webinar this evening. I want you to stick to the end. We'll be asking you very simple questions that you'll be answering in the chat section, and you stand a chance to win this 5,000 naira medication voucher. Also, Dr. Maka mentioned a couple of things about Medicina Clinic, which is the brain behind why we're here, and the clinic offering this diabetes reversal to you. And so I want to give you a little bit of information on what the Medicina Clinic is about. So it is a nutrition support clinic that provides you with dietary advice and everything that you need to help you manage chronic illnesses like diabetes, hypertension, even people that are dealing with obesity and need some expert professional help. So we have a team of experienced dietitians that are on standby to guide you and give you a personalized experience and give you all the care that you need to empower you on a journey to better health. All right. So one of the ways that we're doing that is by bringing you the diabetes reversal clinic, which is what we're talking about today. All right. So everything that you need to know about diabetes, reversing diabetes, will first of all have the clinic where you can have the one-on-one experience with our dietitians. So it doesn't matter where you are in Nigeria or even outside of the country, you will be able to get access to this clinic. But I don't want to get ahead of myself. We have registered dietitian Tito Ipimoye, much more in diabetes. Hi Tito, can you hear me?
Okay. Can you hear me? I think I can hear you now. Can you hear me? Hi,
I
Lois.
can hear you now. How are you
Oh,
doing
okay.
today?
So I'm sorry. Fine, thank you. I'm sorry I've not had light all day. I've been sweating, and so I had to come outside to sit down, so that everybody, so that we can have a good time. Good evening, everybody. My name is Tito Ikumoye, and I am a clinical dietitian at the Mediterranean Clinic. I'm the lead dietitian. And so what that means is that for as many people as would come and join us at this clinic, I would be, your best friend for the duration of time that the program is going to run. So Dr. Maka has spoken, and she has spoken about, what diabetes is, what causes it, all the medical implication. And what she has also mentioned is the fact that yes, it is reversible with so many drugs, drug therapy, lifestyle therapy, and why we're here today is to talk about the lifestyle therapy. Now, one of the things that I discovered very early as a dietitian, and when I was working at the National Hospital in Abuja, especially when they bring in a patient and the patient is dead. They just rush in a patient, ketoacidosis, the person has gone into coma, and in the next 24 hours, the person is dead, or they have to cut a limb or something. It never used to make sense to me. I never used to understand how, something as simple as diabetes was killing people. It just did not make sense. But what I now discovered, during as I went on in my career, was that people did not have access to the right kinds of knowledge and tools to manage this disease condition. So, for example, when you're managing diabetes, they say eat vegetables, they say eat fruits, they say do portion control, but nobody exactly explains to you in details how you're supposed to do these things. So they just say portion control, portion control, portion control. Okay, eat vegetables. All right, but how are you going to do it to ensure that you're doing it in the right way, in the right portion, ensure that you're just doing everything right? There's just a gap in conversation around, these things. And that's why we set up this clinic. I am so passionate about diabetes management. I have focused the last 5 years of my career helping people effectively manage their diabetes and also reverse it. And so what you get, with Mediterranean Clinic, especially with this program, we are running a 12 weeks program. And in those 12 weeks, we work with you. Now, I know what a lot of people are expecting is all the do's and don'ts. But what people do not understand is just like drugs. A practical example I give patients at the clinic, chloroquine. I know that when I was little and I had malaria before this ACT combination came out, we were all given chloroquine and pyritin. Now there's a class of people that would use pyritin and chloroquine and it has no effect on them. There's a class of people that use chloroquine like me and we will itch all night. And also there's a class of people that if they dare use pyritin, they will have lesions all over their body. So what works for Mr. A might not work for Mr. B and definitely doesn't work for Mr. C. And that is why when it comes to diet therapy, there is no one size fits all, because a lot of people think I'll just come and say, okay, don't eat rice, eat beans. But another example I see in clinic, oats, for example. I have some patients that when they eat oats, their blood sugar is fine. As soon as another person eats that same oats, their blood sugar will hit 350. 2 weeks ago, I was talking to a patient and she was telling me, oh, she eats absolutely everything except ogbono. That the moment she eats ogbono, her blood sugar hits 300, 350. Now, that's a problem. And, and so if I have come to, if I told her, give her just general facts and figures and say, oh, you can eat this, you cannot eat that, she would just keep wondering, why does my blood sugar keep going up? And so that is why when it comes to the nutritional management of diabetes, what works for this person might not work for the next person, and definitely will not work for Mr. C. And so what this program is focused on doing is to help you, give you a personalized plan. And so for 12 weeks, my dietitians and I at the Mediterranean Clinic will be your best friends. We'll call you every morning, apart from the customized meal plan, because everybody just wants to give them meal plan. Apart from the customized meal plan, what we also do is we ensure that we follow you day to day, and day to day management is key in reversing diabetes, especially because what we are trying to do is maintain your blood sugar so that by the time we do your HbA1c, we get what's it called? We get a leveled blood sugar value. And so it's important that we follow up every daily. We and that's what our dietitians do, and that's why you should come and join us at Mediterranean Clinic. This program, just runs for 12 weeks. And for now, it goes for 12,000 naira. We've been running this program for the last 2 months, but the 12,000 naira is ending by May 1. Yes, May 1, and it goes back to 60,000 naira. And so if you are interested in reversing your diabetes, if you're interested in working with me, I have worked with over 5,000 diabetes patients across Africa. I specialize in diabetes management, and I help people like you manage their diabetes. Now, one of the common complaints I hear when people are managing diabetes is that they say, oh, I no longer eat food, and I no longer enjoy my meals. I no longer, I'm not happy when it comes to food. And then I have the other class of people that will say, well, something has to kill a man, and it can as well be food, And so I'll give another example. Growing up, I'm from Ekiti, and if there's anything you know about somebody that comes from Ekiti, is that we love to eat pounded yam. In fact, it is almost an offense if you give me poundo or semo. It's an offense. And so this man had diabetes, and they took him to the teaching hospital in Ado Ekiti. That's the capital of Ekiti State. And they told him, sir, you cannot eat pounded yam. You cannot. And he said, please, 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 I will go and die in peace in my village. And when I heard about it, because he's actually a very close family member, it hurt me very badly, because you can eat your pounded yam, you can eat your bread, you can eat your rice. But like I said, what works for Mr. A doesn't work for Mr. B, and definitely would not work for Mr. C. And that is why when it comes to this management, it is individualized, it's personalized, it is never a one size fits all. And so working with us at the Mediterranean Clinic, what we do first, first things first, is we ask you, what is your food preference? What are the things you want to eat? What are the things you love to eat? What are the things you enjoy eating? And that's what we work with. We would draw a meal plan for you based on your food preferences, and then we would follow up every morning. Now, one of the other importance of following up every morning is, if, for example, yesterday you ate eba and, let's say, moi moi and bread, and this morning we record a high blood sugar, it is very easy to pinpoint exactly what shut up your blood sugar, as against people that just check once a week or once in 2 months. I have patients that come and they say, oh, we've not checked our blood sugar in the last 3 months. And I'm like, how do you know if you are progressing or not? And so it's really, really, really important that you work with us at the Mediterranean Clinic. Now we have a 86% success rate, and why we have that. Please, have you been able to call him? Lois, I don't know if you can still hear me. Lois, can you hear me?
Hi, Tito. Can you still hear me? We can hear you loud and clear.
Okay, yeah, I got my network back. Okay. Um, so as I was saying, um, when if you are not able to track your blood sugar value every morning, how do you then know? How do you know what is not working for you or what works for you? Okay, like I said, we have patients that come in and they say they've not checked their blood sugar in 3 months, and I'm like, how do you know what works and what doesn't work? And that's what we do differently at the Mediterranean clinic, and that's why we are able to record such a high um, 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 impact when it comes to management of diabetes, when it comes to the reversal of diabetes. Now, we have three categories of people. Number one, we have those people who have pre-diabetes. It's not yet full-blown diabetes. And in those people, what we do is we work with them to ensure that it does not become diabetes. Then we have people that have managed and controlled their diabetes, but then they still have occasional, fluctuations. It goes up, it comes down. They don't know what they are, every now and then. They just have a general idea of, how to manage their diabetes. And with those people, we work closely with them and their primary physician. Now, I am not your primary physician. I'm just your dietitian. So it means that I would have to work closely with your caregiver or your doctor or your nurse, to achieve this. Now, one of the other important things that we do in this program is that we would write you an extensive note to your doctor, because I have seen patients do a lot of abracadabra. Case in point, people will go and drink bitter leaf on the morning that they want to go and see their doctor, so that they have low blood sugar, and their doctor doesn't, the doctor, healthcare professionals, we've seen a lot of things. And so if you go and meet your doctor to say, oh, my blood sugar is resolving, they don't know if you are telling the truth or not. Now, why it's important to work with a clinic like ours is, at the beginning of the program, we write you an extensive note. At the end of the program, we write you an extensive note. Now, back to the second category of people we work with. Your blood sugar is controlled, but it spikes every now and then. You don't know what to eat. You're trying absolutely everything. We work with you to ensure that, one, we are able to teach you how to eat well, and so that in the next 6 months, you're not looking for the next dietitian or you're not hopping on the next diet. We teach you a sustainable way to manage your diabetes and ensure that we push that diabetes to remission. So this means that whenever you check your blood sugar is within range. You are not going to have a high blood sugar spike again after our program. Now to the last category of people, which make up for the other 14%, in our 100%, like I said, we have 86% success rate for reversal. Now the remaining 14% are for people that have lived years with uncontrolled diabetes. Sometimes their diabetes is 600, sometimes 500, sometimes 450, and even with drugs, they are still not able to control it. Now, for those kinds of people, there is really no abracadabra we can do. But what we are able to do is work closely with them to ensure that even with their drugs, they do not hit those high figures. And so it means that for those kind of people, they might not be taking off their drugs completely. Again, it is your doctor's call. When you come to us, I have a lot of people say, oh, when I wanted to start this program, I stopped taking my drugs. No, please continue to take your drugs. It is doctors like Dr. Amaka that will make the call to decide whether you will stop your drugs or not. Mine is to work with you to ensure we get to that point where your blood sugar is effectively managed and you are taking off the drugs. Now, for the category 3 people, what we are going to do is work with you, ensure that even with drugs, your blood sugar is properly managed, and then your doctor can make a call to say, okay, if this person is on drugs twice a day or 3 times a day, let's reduce it to once a day or twice a week, or any other time in the week. Again, that's your doctor's call, and that is why we work closely with your doctors. If you have seen some other programs online, there are so many diet programs online. None of them work with your doctor. They will just give you, eat this, don't eat this. You are only allowed to eat this. But because we are a clinic and we only do clinical and evidence-based practice, it's important that we work closely with your primary physician. We will send them a note, we will send them your progress report, and so that when it is time to take you off your drugs, or make your doctor is able to make an informed decision, on how to take the next step. Again, between today and May 1, The program runs for 12,000 naira. This program has run for, I think, a period of 2 months. Our target was to work with 100 people and help 100 Nigerians effectively manage their blood sugar with just 12,000 naira. However, this program goes back to 6,000 naira once it's May 1. So if you are interested in being a part of what we are doing, please make your payments before May 1, and I would be very, very glad to see you in clinic. So you can join. Our clinic is somewhere in Lekki, but we also do virtual consultation. So it's okay if you're not in Lagos. It's okay if you cannot make it to Lekki. I would also be available to talk to you from anywhere around the world, anywhere in Nigeria, Ibadan, Kano, Abuja, Zamfara, anywhere you are. I am available to have a virtual call with you. And I mean, the only thing that you are going to be missing is my fine face physically. If there's anything that COVID has taught us, is that, we can access healthcare from anywhere around the world virtually. I think that's all from me for now. Thank you very much, Lois.
Thank you so much, Tito. Um, that was amazing as always. And I believe it answered a lot of the questions that so many people had as to what actually goes on in our 12-week diabetes reversal clinic. All right. So if you still have some questions, I see that some people have some questions for Dr. Amaka. So we'll get to those. But if you still have some questions, if you're not entirely clear, you can put it in the comment section wherever you're joining from. So whether you're joining from YouTube or you're joining from Twitter, all right, we'll see these questions and we'll give you the appropriate responses. We want you to know everything that you need to know about reversing diabetes, all right, from Dr. Amaka as well as registered dietitian Tito. We've heard that it is possible to actually reverse diabetes. There is a way to go about it, not by what everyone else is telling you, but in the diabetes reversal clinic brought to you by Mediterranean Clinic, you can actually get this and have the experts take you through a personalized experience. One thing that registered dietitian Tito said is this, that diet therapy is not a one size fits all, meaning that what works for Mr. A or what works for your auntie that is living in Lagos may not work for you for so many different reasons. Our bodies act differently and respond differently to the things that we take in. And you want to make sure that you are having the absolute best care for yourself. All right. So the best way to do that is to join the Mediterranean Clinic. And here is what is important about this clinic. It's currently going for 12,000 naira only. So if you pay 12,000 naira for the next 12 weeks, you're going to have access to either Tito or any of our other dietitians on our team, and they'll be taking you through an everyday experience to make sure that you're able to bring your diabetes to the level that you want it to be. So the link is in the chat section wherever you're joining from. If you follow us on social media, you can find us on Facebook, find us on Instagram, find us on Twitter. You'd be able to see the links in our bio, link in our description, or wherever we have posted about this webinar that is currently ongoing, right? You would see the link to joining, or you can put it in the chat section and would keep sending it to you to make sure that you can join. That is in 2 days. This diabetes reversal clinic will be going back to 60,000 naira for 12 weeks. So you want to take advantage of this. You want to share it with everyone that you know that needs to be a part of this and to take advantage of it while it is still at the current price. Remember, from the 1st of May, again, which is in 2 days, you have to pay 60,000 naira. But for now, if you pay between today and tomorrow, I believe, as well as next tomorrow, you're going to be able to get it at 12,000 naira only. And you have a personalized experience. What that means is one on one with the dietitian. They follow up on the things that you eat, give you extensive notes, like Tito mentioned, to make sure that they're monitoring everything to give you the best possible care and have you reverse diabetes. All right. Thank you so much, Dr. Maka. Thank you so much, Tito. We'll be coming back to the questions in a bit. I see someone just dropped another question. But before we get there, remember we said there is 5,000 naira worth of medication vouchers. So for those of you that are currently watching, meaning that you stand a chance to win 5,000 naira, in medication vouchers. So, what I'm going to do right now is this: I'm going to be sending you a question to the comment section. So, if you're watching from YouTube, just look in the chat section. I'll be dropping a question for you now, as well as on X. The first person to send in the correct answer. All we need from you is the letter. You don't have to type out the whole answer. So if your answer is A, just type A and send. If your answer is B, type B and send, and so on and so forth. And the first person to send in the correct answer stands a chance to win, or will win 5,000 naira worth of a medication voucher from us. All right, so I'm putting the first question in the chat section. I want you to look for it now. This person to give us the correct answer, first person from YouTube or X, would get the 5,000 naira medication voucher. So the question is live. I want you to look at it and I want you to send in what you think the correct answer is. Remember, this is for 5,000 naira worth of medications for you. Five of medications for you. So much. I've seen a couple of responses from YouTube. I've seen about one, two, three, four. Thank you, Fola. Thank you, Ibro. Thank you, Thomas. Thank you, Wudu, for sending in your answers. But the first person to get it correctly on YouTube is Olufola. So, Fola, congratulations, you have won our 5,000 naira medication voucher. What I want you to do right now is to send us a WhatsApp message to the number that I'm typing right now. So, send a WhatsApp message to this with your name, and we would reach out to you to claim your prize. So, Olufola was the first person, and then I'll be looking out for the winner on X, the first person to get it. All right. Once again, our diabetes reversal clinic, which is where you have access to our dietitians, is going for 12,000 naira. Listen, after hearing everything from today's webinar, if you miss out on this, you have missed out on a lot. It's going for 12,000 naira, but it will be moved to 60,000 naira on the 1st of May. So you want to grab this deal. I mean, it's amazing for you to get everything that Tito talked about, a one-on-one experience, following up on you every day, checking up on your blood sugar levels, checking up on what you're eating, making sure that you have someone to respond to your questions every time that you need that. It is available for only 12,000 naira. Only 12,000 naira. So, like I mentioned, I'll be sending you the link once again in the comment section wherever you're joining from. Use that link to join the Diabetes Reversal Clinic. You can join in right now, even as we're still live. You can click on the link, just fill in a couple of details and make your payment, and you are good to go. You have access to the clinic. Remember, it doesn't last so long. That is the offer that we're giving for 12,000 naira. So you want to take advantage of it now. All right, so we've had one winner. I want to give another opportunity to someone. Okay. Meaning that Olufola, thank you for winning the first one, but you wouldn't be able to participate. You've already won the first 5,000 naira medication voucher. However, everyone else that is on this call, on Twitter, on YouTube, can participate. So the rules remain the same. I'll be sending another question. All you need to do is to send the option, send the correct option. That is, if the answer is A, send A. If the answer is B, send B. No need to type it out. So it is a fastest fingers first sort of thing. Whoever gets the answer first is going to win 5,000 naira worth of medication vouchers. So I'm sending in the next question now. Um, so good luck to everyone that has joined, and yeah, we'd love to start seeing your answers. Okay, we've started seeing a couple of answers from YouTube. Thank you, thank you, thank you. Thank you, Tony, for your answer. Thank you, Thomas. Anthony. All right. Okay, I believe we have a winner from our second question on YouTube. So the winner of the second 5,000 naira medication voucher is Thomas Opeyemi. Congratulations, Thomas. I'll be sending our WhatsApp number. Send us a message and we would follow up to make sure that you can redeem 5,000 naira medication voucher. So for our winners today, congratulations, Olufola as well as um, Thomas Opeyemi. They were the first to get the correct answers. All right. So one more time, I want to send the information for our diabetes. Again, this is your opportunity. You have personalized guidance from dietitians who will guide you on a journey to meet universities. They will be there to answer your questions, to follow up on you for every single thing that you need throughout this journey. And it lasts for 12 weeks and it is currently going for 12,000 naira only. Remember, once it is the 1st of May 2024, it will go back to you, your loved ones, every this. You need to send them this link. If you're following us on social media, which you should be, you can find us on Twitter, you can find us on Facebook, you can find us on link in our bio. You'll be able to use the link to also register. So send it to everyone that you know. Register now. Um, Make sure that you're able to grab this offer while it lasts. 12,000 naira only is an amazing deal for you to get everything that we are offering. For every single thing that we're currently offering in 12 weeks, you can get it for 12,000 naira before it goes up to 60,000 naira. So once again, you can find it in the comment section. You can find it on any of our social media channels. And also follow us for so much more information. We'll be doing giveaways even outside of the webinar. We'll be having a lot of information that would help you to be able to manage chronic conditions, everything that you need to know, giving you access to doctors, to dietitians, platforms like this that help you to ask the questions that you need, help you to get everything that you need to know and live a healthier life, healthier, happier life. That is why Medicina Clinic is here. So once again, congratulations to our two winners, Olufola and Thomas Opeyemi, for winning the 5,000 naira medication voucher. Once again, you can send a WhatsApp message to the number in the chat section. All right, I'm putting that number again for our winners. Send us a WhatsApp message and we'll be able to get you to redeem your prize. The the link to joining the clinic is in the chat section. I'm giving you enough time so that you'll be able to copy it, you'll be able to share it with people. You yourself will be able to get on it this evening, right? Make the payment before the offer elapses. And I just want to say a very big thank you to Dr. Amaka as well as registered dietitian Tito for giving us all the information that we've needed tonight to get us going, and for answering a lot of questions that I know we came in with. For as many questions as were asked, what you can do is to either send us a message. So the WhatsApp number that is in the chat section as well, you can use that to send us a message. You can speak to a doctor and have them answer all the questions that you need that we may not have been able to answer this evening, right? And even to still sign up for the Diabetes Reversal Clinic through our WhatsApp channel. But if you want to get straight access, if you want to make sure that you are snagging up this deal of 12,000 naira, use the link that we have put in. And once again, to our winners for the 5,000 naira medication evening. Would love to help you reclaim your prize and to enjoy what you have won. So look out for us. We may be having another webinar soon where you can tell your friends, tell your family members. Also, follow us on social media: Facebook, Instagram, Twitter. Just search for Medicina Clinic, right? You see us there. Follow us, turn on our post notifications so that you have an in on everything that we are offering, more discounts on our clinics, more giveaways, much more information, access to the experts that would help you to live a happier and a healthier life, all made available for you. So, once again, thank you to every single person that joined us this evening. Thank you to every single person that participated in our giveaway. Thank you, Dr. Maka. Thank you, Tito. And we hope to see you next time. Have a wonderful evening.